My presentation is on Wilms tumor, and my name is Amanda Muxlow. Wilms tumor is the most common renal tumor in children. It occurs with, which is familial, or without, sporadic, a family history of it. It can occur in one or both of the kidneys. Bilateral is more common in familial cases. Cause is unknown, and this is a picture on the right of a kidney with a Wilms tumor, and I got it from the mayoclinic.com. Incidence and population affected. About 8 cases per million occur under the age of 15 years old. This accounts for 6% of all children's cancers, and children are typically diagnosed between the ages of 2 and 5, but it can be seen in neonates and into adulthood. Manifestations, it's typically asymptomatic. You will find a abdominal mass that is almost always discovered by parents during bath time. It can be discovered by a healthcare provider during a physical. Some not so common manifestations are microscopic or gross hematuria, hypertension, abdominal pain, fatigue, anemia, and fever. Like I said, those aren't very common. It's a small amount that those actually happen in. It is typically found by the parent. Diagnostics: an abdominal ultrasound is initially done to determine a solid mass. Abdominal CT, MRI, and chest X-ray and chest CT are done to know the extent of the disease. Lab tests such as CBC, electrolyte levels, liver and kidney function tests, and a urinalysis. Surgery is the most definitive form of diagnosis. Treatment for Wilms tumor includes surgery and chemotherapy. This can be done with or without radiation. A complete surgical resection is common at the time of diagnosis. And if the mass is too large, only a biopsy will be performed, and chemo will be used to shrink the tumor to a more manageable size until it can be removed at a later time. Prognosis for Wilms tumor is quite good. The survival rates are higher for children with Wilms tumor than many other forms of cancer. Children also have a 90% survival rate, so these are really good odds if caught early enough. Nursing interventions. The most important thing to know if you're a nurse treating a child with Wilms tumor is that you do not palpate the tumor during the assessment. This can cause it to rupture its protective capsule, and it can also cause seeding, which can spread the cancerous cells. It is also important to put a sign in the child's room warning against palpating for other staff members. Nursing interventions continued. The nurse should offer support to the family and child, answer any questions about treatment or surgery, and give reassurance. For post-op, you want to monitor GI activity, bowel sounds, abdominal distension, and stool production. You want to also watch for any signs of infection, any signs of hemorrhage, and changes in blood pressure. And you also want to monitor urine output from remaining kidney. That's very important. This is my first journal article, and it was Curcumin suppresses Wilms tumor metastasis by inhibiting REC myolethin I'm not sure how to say that word. So curcumin, it's a polyphenolic compound, and it's separated from turmeric. It has anti-tumor agents and is much safer than chemotherapeutic drugs. It reduces the REC methylation in Wilms tumor, which is associated with tumor metastasis. It also can decrease tumor progression. And my second journal article is the effectiveness of Wilms tumor screening in Beckwith-Wiedemann spectrum. Patients with Beckwith-Wiedemann spectrum had a higher occurrence of Wilms tumor diagnoses between the ages of 12 and 84 months. Patients with BWS and WT diagnosed through screening had lower stages at diagnosis compared to patients with BWS that were not screened. Screening for BWS until age 7 is effective in detecting about 95% of all Wilms tumors. Growth and development. If caught early enough, there should not be any lasting growth and developmental effects for the child. For the infant, at this age, the child will not understand anything related to treatment or the disease. They are beginning to develop a sense that everything in life is good. Likely, they will not remember anything from this age. Toddler. This is the age that they typically get diagnosed at. This age, they are beginning to develop a sense of control over their self and body functions. This can make it harder for them to learn tasks such as potty training. You will want to prevent this child from roughhousing for risk of injuring the remaining kidney. Preschool age. This age, they are starting to develop a can-do attitude about self. They could be discouraged due to feeling different than peers. If a kidney is removed, they will want to avoid pee-wee sports such as soccer and football to prevent damaging remaining kidney. For school age, at this age, they would usually be beginning to learn how to work and play with peers. This disease may make it harder for them to build relationships as they may be doing treatments rather than playing sports or socializing. They will want to refrain from any contact sports to prevent any injury to their healthy kidney. Adolescents, they are beginning to have independence at this age. They understand what treatment is and why they need it, but this may make them feel isolated from their friends or peers. It is important for them to avoid any contact sports such as soccer or football so they do not injure their kidney. Residual effects in adult comparison. This can lead to reduced kidney function, heart or lung problems after getting certain chemotherapy and radiations to the chest, delayed growth and development, changes in sexual development and ability to have children, especially in girls. And it can lead to an increased risk of second cancers later in life from the chemo and radiation. My first question: a nursing instructor is monitoring an assessment of a student nurse with a 3-year-old with Wilms tumor. What would require immediate intervention from the instructor? A. Listening for bowel sounds. B. Palpating the abdomen. C. Assessing blood pressure. Or D. Monitoring for signs of abdominal distension. I'll give you a minute to think. The answer is B, palpating the abdomen, and the rationale is the tumor mass should not be palpated during the assessment because of the risks of rupturing the protective capsule. Excessive manipulation can cause seeding of the tumor and spread of cancerous cells. My next question: a nurse doing an assessment on a child with Wilms tumor would expect to find A. Severe abdominal pain, B. Fatty stools, C. A palpable abdominal mass, or D. Hypotension. Now I'll give you a minute. The answer is C. A palpable abdominal mass. The rationale: the most common sign of Wilms tumor is a painless palpable abdominal mass. Hypotension and fatty stools are not a symptom of Wilms tumor. And these are my references.